Hey guys, welcome to my channel, Not Just a Medico. I'm back with another video of important questions in musculoskeletal and sports physiotherapy, that is PT Ortho. In this video, you'll get all the frequently asked questions that were repeated in your previous year question papers. I have included maximum number of questions, so if you prepare all these thoroughly without skipping any question, you will not just pass but you can easily score distinction in this subject. And guys, remember that any topic can be asked for both clinical and PT ortho. For example, torticollis can come in clinical ortho, and in that you have to write about surgical management. And it can also come in PT ortho where you have to write about PT management. And that's why it is important to study every topics from both perspectives. And I have already uploaded a video on clinical ortho, you can check it out. And if I have given one particular topic only in one video and not in other, that doesn't mean that that particular topic only comes in that subject. So while studying, make sure to refer both the videos. Now without any further delay, let's get into the video. As you can see, the first topic is about PT assessment for orthopedic conditions. In this, the important 5 or 10 mark questions are: the first one, any two diagnostic tests to assess ligament injury of knee in detail. Second one, discuss any three special tests for lateral epicondylitis. Third one, define limb length discrepancy. Explain the methods to measure true and apparent limb length. Fourth one, upper limb tension testing. And in the same topic, the important 3 mark questions are: the first one, write the procedure and interpretation of straight leg raise test. Second one, list the outcome measure for pain and mobility physiotherapy assessment. Third one, sit and reach test. Fourth one, Finkelstein test. Fifth one, Millie's test. Sixth one, Uber's test. Seventh one, name the grades of manual muscle test. Eighth one, what is patellar tap test? And last one, Roos test. Now coming to the next topic, that is fractures. In this, the important 10 or 5 mark questions are: the first one, guidelines for fracture management following immobilization. Second one, RSD and its physiotherapy management. Third one, complications of fracture. Fourth one, describe fracture healing. Mention the common complications of fracture. Fifth one, pathogenesis of complex regional pain syndrome. Now coming to the important 3 marks. The first one, define isometric exercise, list two indications. Second one, mention physiological effects of PNF stretching techniques. Third one, explain the various reduction methods of fracture. Fourth one, VIC, that is Volkmann's ischemic contracture. In the next topic, we have fractures and dislocations. In this, the important 5 or 10 mark questions are: the first one, it is related to recurrent shoulder dislocation, and in this, you need to mention the surgical management and post operative physiotherapy goals and management. Second one, what are the immediate complications of mid shaft femur fracture? Explain the short term and long term goals following internal fixation of femur. Third one, explain the principles of physiotherapy management in trimalleolar fracture of ankle treated conservatively. Fourth one, what are the common complications of Cooley's fracture treated conservatively? Explain the methods used to improve the range of motion of wrist joint. Fifth one, describe physiotherapy assessment and management of fracture of shaft of femur and its complications. Sixth one, radial head fracture and its PT management. Seventh one, classify patellar fracture and postoperative PT management. Eighth one, what are the types and complications of shoulder dislocation? Explain the PT management following surgical management for anterior shoulder dislocation. Ninth one, list the types and complications of supracondylar fracture of humerus. Explain the PT management following surgical management for supracondylar fracture of humerus. 10th one, explain the PT management for Galeazzi fracture. 11th one, set down a detailed plan of rehabilitation following L2 vertebral level fracture treated surgically with a spinal fixation device and presently in recovery phase after 1 month. 12th one, write in detail about PT management following shaft of femur fracture. What are the common complications seen in this condition? 13th one, discuss in detail about the assessment and PT management for a 32-year-old male ended up with a paraplegia following burst fracture of first and second vertebra. 14th one, supracondylar fracture of humerus and its PT management. 15th one, what are the causes of spinal fracture with emphasis for PT management for T10 level. 16th one, what are the complications of scaphoid fracture and write its PT management after the removal of POP. 17th one, describe the management for fracture of shaft of humerus with radial nerve palsy. And the last one, complications of supracondylar fracture of humerus. Now coming to the important 3 marks. The first one, list the muscles involved in radial nerve palsy. Mention the splints used in wrist drop. Second one, boxer's fracture, Cooley's fracture, Jones fracture, described wind-swept deformity, classify fracture of pelvis. Now coming to the next topic, in this the important 10-mark question is, mention 4 uses of laser therapy in tennis elbow. In this there are no 3-mark questions. Now moving on to the next topic, that is principles of various schools of thought in manual therapy. In this, the important 5 or 10-mark questions are, the first one, classify Maitland mobilization with its indications. Second one, explain the 3 pain syndromes of Mackenzie concept. Third one, indications and contraindications of Maitland's mobilization. Fourth one, explain centralization and peripheralization phenomena and add a note on extension bias exercises. In this, the important 3-mark question is dysfunction syndrome of Mackenzie concept. Now, moving on to the next topic, that is degenerative and inflammatory conditions. And in this, the important 5 or 10-mark questions are, the first one, what are the clinical features of ankylosing spondylitis? Explain the PT goals and plan of care. Second one, this question is related to OA, that is osteoarthritis, which is given indirectly. Third one, Perthes disease and its PT management. Fourth one, write in detail about rheumatoid arthritis and its PT management. Fifth one, again it is repeated. It is of the same topic of the first question. Sixth one, discuss various exercises as a home program for osteoarthritis of knee. Seventh one, explain physiotherapy assessment for rheumatic hand. And the last one, define arthritis, stages of arthritis of knee joint, and write in detail about the assessment and physiotherapy management of total knee replacement. Ninth one, it is repeated again. And the 10th one, exercise program for ankylosing spondylitis. 11th one, what are the causes of deformities of hand in rheumatoid arthritis? And write about PT management of RA and energy conservation techniques. Coming to the important 3 marks, the first one, strengthening techniques for scapular retractors muscle. Z-thumb deformity of hand, gout. What is swan neck deformity? Z-thumb deformity, it is repeated again. Energy conservation techniques, clinical features of gout. Now moving to the next topic, that is infective conditions. In this, the important 5 or 10-mark questions are, the first one, septic arthritis and its management. Second one, PT assessment following TB spine. Third one, POTS spine and its PT management. Fourth one, define osteomyelitis, its clinical features, signs and symptoms. Write an assessment and physiotherapy management for osteomyelitis of knee joint. Now moving on to the next topic. In this, the important 5 or 10-mark question is, explain the various spinal orthosis and SOMI brace. Coming to the important 3 marks, what are the causes of forward neck posture? List one evaluation method. And the next topic we have is deformities. In this, the important 5 or 10-mark questions are, the first one, kyphosis and its PT management. Second one, pes cavus and its PT management. Third one, describe the postoperative management following Harrington rod fixation for a thoracolumbar scoliosis. Fourth one, what are the causes of genu recurvatum? Write about PT management of the same. Fifth one, prepare a PT assessment chart for a 15-year-old girl diagnosed with scoliosis. Sixth one, describe the PT management for torticollis. Seventh one, role of physiotherapy in CTEV. Eighth one, torticollis and its PT management. Ninth one, define CDH, write down the assessment and PT management for the same. 10th one, physiotherapy management for pes planus. 11th one, classify scoliosis with the management for the idiopathic type. 12th one, define CTEV, write the brief surgical management for the same. 13th one, describe the congenital spinal conditions of lower back and its PT management. Now coming to the important 3 marks. First one, name two corrective brace for scoliosis. Second one, claw 2. Third one, orthosis of CDH. Fourth one, what is Cobb's angle? Fifth one, genu recurvatum and its causes. Now moving to the next topic, that is cerebral palsy. In this the important 5 or 10 mark questions are: the first one, define CP, its classification, clinical features and PT management. Second one, gait deviations observed in scissoring gait. Moving on to the next topic, that is poliomyelitis. In this the important 5 or 10 mark questions are: the first one, PT management for correcting the deformities in poliomyelitis. Second one, common deformities seen in poliomyelitis and explain the same. In 3 marks, we have poliomyelitis PPRP, that is post polio residual paralysis. Now, coming to the next topic, that is leprosy. In this, the important question is: what are the ways to intervene for anesthetic hand in Hansen's disease? Now, moving to the next topic, that is amputations. In this, the important 5 or 10 mark questions are: the first one, define ideal stump and classify the levels of upper limb amputation and add a note on stump bandaging and management. Second one, what are the different levels of amputation in lower limb and management of below knee amputation? Third one, describe the postoperative PT management for above knee amputation, including prosthetic training. Fourth one, discuss the various types of prosthesis for above knee amputation. Fifth one, explain types of prosthesis for below knee amputee. Sixth one, what are the causes and management of phantom pain? Seventh one, stump care and bandaging. And let me tell you all that you cannot skip this chapter, guys. This is very important chapter. Now moving on to the next topic, that is spinal conditions. In this the important 5 or 10 mark questions are: the first one, write down the PT assessment for posterolateral disc prolapse at L4 and L5 level. Second one, list special test for cervical spondylosis with its interpretations. Third one, spinal canal stenosis and its PT management. Fourth one, explain lumbar spondylosis with PT management. Fifth one, importance of core stabilization exercises in the management of LBA. Sixth one, spina bifida and its PT management. Seventh one, describe the different stages of intervertebral disc degeneration with PT management of cervical spondylosis. Eighth one, what are the causes of spondylolisthesis and write the exercise prescription for the same. Ninth one, it is repeated again. Coming to the important 3 marks, the first one, grades of spondylolisthesis. Second one, lumbosacral angle. Third one, X-ray features of spondylosis. And the next topic is effects of spinal traction. In this, there is only one question, that is types, precautions, and limitations of spinal traction. Next topic is osteoporosis. In this also there is only one question, that is what are the predisposing factors of osteoporosis? Write in brief about the importance of exercise in the management of the same. Next we have orthopedic surgeries. In this the important 5 or 10 mark questions are: the first one, explain postoperative PT management for tendon transfer. Second one, explain the principles of tendon transfers. Third one, postoperative PT management following proximal realignment of quadriceps. Fourth one, postoperative management after tendon transfer in foot drop condition. Now coming to the important 3 marks. The first one, list the principles of tendon transfer. Last one, that is excision arthroplasty of hip and its indications. Now coming to the next topic, that is related to shoulder joint. In this the important 5 or 10 mark questions are: the first one, PT management following slap. Second one, explain the PT management for AC joint dysfunction. Third one, describe the PT management for patients with shoulder instability. Fourth one, what are the causes of thoracic outlet syndrome? Mention two confirmatory test for it. Fifth one, define impingement syndrome. Describe the clinical features, assessment and PT management for subacromial impingement. Sixth one, PT management of thoracic outlet syndrome along with special test to diagnose the same. Seventh one, again it is related to the same topic, that is thoracic outlet syndrome. And the eighth one, PT assessment and management of recurrent dislocation of shoulder. Now moving on to the next topic, that is wrist and hand. In this the important questions are: the first one, describe the management of patient with carpal tunnel syndrome. Second one, explain the PT assessment of carpal tunnel syndrome. Third one, PT management in wrist drop. Fourth one, carpal tunnel syndrome. Fifth one, write in detail about the extensor zones of hand and its PT management following injury. Sixth one, carpal tunnel syndrome and its PT management. Seventh one, define flexor zones of hand and add a note on PT management following injury of the flexor zones. Eighth one, Dupuytren contracture and its PT management. Next topic is related to hip. In this, the important questions are: the first one, write the physiotherapy postoperative management of THR from day 0 to 8 weeks and add a note on precautions to be taken after THR. Second and third question is same, that is PT management following THR. Fourth one, enumerate in detail about the assessment and PT management for THR in a 60-year-old female following fall in bathroom. Write a note on do's and don'ts in rehabilitation following the total hip replacement. All these four questions are of the same topic, but these are the ways that they can twist and give you the question. In short, you have to prepare well for THR. This is very important question. Now coming to the next topic, that is knee. In this important questions are: the first one, write with examples of closed kinematic and open kinematic chain quadriceps strengthening exercises. Second one, explain the procedure and interpretation of manual muscle testing of quadriceps muscle. Third one, describe the mechanism of locking of knee with emphasis on the role of meniscus during the knee extension. Fourth one, what is proprioceptive training and explain briefly the proprioceptive exercises for the knee joint. Fifth one, patelectomy and its PT management. Sixth one, anterior cruciate ligament injury, its special test and PT management. Seventh one, define TKR, plan your PT assessment and management for the same. Eighth one, special test for ACL. Ninth one, special test for ACL injuries of the knee joint and PT management for the same. 10th one, how do you tape for chondromalacia patella as per patella's various malalignment? 11th one, name and describe any two tests to diagnose meniscal injury. 12th one, plan the rehabilitation protocol for ACL reconstructive surgery through arthroscopic procedure. Last one, grading of patellar tendon injury and its PT management. In this, there is only one important 3-mark question, that is causes of patellar lateral dislocation. Now moving on to the next topic, that is ankle and foot. In this, the important 5 or 10-mark questions are: the first one, classify ankle sprain and write about its PT management. Second one, mechanism of injury of lateral ankle sprain and its conservative management. Third one, grades of ankle sprain. Now coming to the next topic, that is orthosis and prosthesis. In this, the important 5 or 10-mark question is amputations of different level in the lower limb and their prosthesis. Coming to the important 3 marks, first one, KAFO, that is knee ankle foot orthosis. Second one, prosthetic knee joint. Third one, functional cast bracing. Now coming to the next topic, that is sports physiotherapy. In this, the important 5 or 10-mark questions are: the first one, physiotherapy assessment for biceps tendonitis along with its special test. Second one, what is plantar fasciitis? Discuss the electrotherapy and exercise therapy management for subacute condition. Third one, define fitness. Explain briefly the components of fitness. Fourth one, components of physical fitness in sports physiotherapy. Fifth one, write in detail the PT management for supraspinatus tendonitis. Sixth one, describe in detail about the stages of healing in soft tissue injury. Seventh one, it is a repeated question. Eighth one, plantar fasciitis, its causes, management, and mention the orthotic prescription. Ninth one, decurvane tenosynovitis, special test to diagnose and PT management for the same. 10th one, PT management for tennis elbow. 11th one, PT management for supraspinatus tendonitis, tennis elbow and its PT management. Next, describe various methods to train aerobic and anaerobic systems. 13th one, write the assessment of a 38-year-old painter with lateral epicondylitis. 14th one, health related physical fitness components. 15th one, PT management following hamstring strain. And the last one, explain in detail about diagnostic testing for bicipital tendinitis. Now coming to the important 3 marks. The first one, painful arc syndrome. Second one, mention 4 uses of laser therapy in tennis elbow. Third one, name the components of fitness. It is repeated again and again and it is a very important 10-mark question. And the next 2 questions are meralgia paresthetica and grades of nerve injury. Next, we have few more questions such as Barton's fracture, energy conservation technique, Hoffa's syndrome, principles of plyometrics, and few special tests such as Roos test, Froment's sign, Kernig's sign, and there's one more question that is intrinsic plus deformity. And there are few more additional important questions. Those are stages of fracture healing, guidelines for fracture management following immobilization, various reduction methods of fracture, and immediate complications of fracture. If you have seen my previous video that is important questions in orthopedics, in that also I had given few important major fractures and dislocations. In the same way, in this subject the important fractures are shaft of humerus, shaft of femur, supracondylar fracture of humerus, Galeazzi fracture, bimalleolar fracture, middle shaft fracture of femur, Jones fracture, Montegia fracture, radial head fracture, Boxer's fracture, Cooley's fracture, stress fracture, talus fracture, both bone fracture of forearm, Barton's fracture, and tibial plateau fracture. The common dislocations are recurrent dislocation of shoulder and anterior dislocation of shoulder. And there's one more important question that is sacralization and lumbarization. And the last two are patelectomy and avian, which are important in both clinical as well as PT ortho. And yes guys, finally we have come to an end of this video. If you find this video helpful, then do not forget to like, share and subscribe to my channel. I'll see you guys in the next video. Till then, take care and bye bye.